Hi, I'm Dr. Valerie Frazer, and today we're going to talk about vision and attention. So, children with vision dysfunctions are 3 times more likely to have ADHD-like behaviors. Why is that? Well, what behaviors do we associate with ADHD? So, not paying attention to detail, taking longer to complete homework, making careless mistakes, failing to keep on task, not listening, being unable to follow or understand instructions, avoiding tasks that involve effort, being distracted, being forgetful, losing essential pieces, items required to complete a task. So, which of these symptoms are commonly related to vision dysfunctions? Well, not paying attention to detail, taking longer to complete homework, making careless mistakes, failing to keep on tasks, avoiding tasks that involve effort, and being distracted are all common signs related to vision dysfunction. So, what type of vision problems are we talking about that can interfere with attention? Oftentimes, when we think about good vision, we think about 20/20 vision at a distance, and that doesn't always predict academic success. Many kids can compensate for needing glasses and still achieve 20/20 visual acuity. Really, it's the ability to efficiently use the eyes at near for reading and writing that can significantly interfere with attention to near tasks. So, what types of visual skills, aside from 20/20, can relate to attention? So, eye teaming, eye focusing, eye tracking, and visual processing are 4 very important visual skills needed to help pay attention. The first visual skill, eye teaming, also known as convergence, has to do with how the input from the two eyes create one picture in the brain. So, each eye needs to be pointing at the same place at the same time. When you look far away, the eyes are straight, and when you look up close, they pull inward towards each other. Good eye teaming skill give us good depth perception and also helps with eye-hand coordination during gross and fine motor tasks, both at distance and near. But if your eye teaming or convergence isn't working very well, you can start to get double vision. Or it can just be a lot of effort to keep things single. So, how well could you read if your vision looked like this? Children with ADHD are 3 times more likely to have trouble with eye teaming in the form of convergence insufficiency. And poor eye teaming skills can lead to other symptoms like headaches or eye strain, difficulty with reading fluency and comprehension. Of course, we talked about reduced attention or avoidance, reduced depth perception, poor eye hand coordination, and difficulties with handwriting or lining things up like numbers in math. Another important visual skill are visual focusing skills, also called accommodation. When you look far away, there's a lens in your eye controlled by muscles that relax just to keep things clear far away. When you look up close, they have to do some work to get things clear. You should be able to both maintain that focus up close and switch between distance and near relatively easily. That usually develops about 4 months of age. Now, as we head into adulthood, it starts to decline. So by the time you reach 40 or 44 or 45 or maybe 50, that lens inside the eye gets stiffer and it becomes harder to move. That's why adults some need to go to bifocals or reading glasses. Poor focusing skills can cause blurry vision or cause distorted vision at near. And it can also lead to eye strain and headaches, difficulty with reading fluency and comprehension, difficulties copying from the board or making that switch from near to far and far to near, difficulties with attention and avoidance. The third visual skill is eye tracking skills, which are 3 different skills really. One is fixation, and that's the ability to hold your gaze on an object. Saccades are the ability to move from one point to another accurately. Those are the movements that we do when we read. And pursuits are the ability to follow a moving object, like when you're tracking a ball. Eye movements, especially those saccades, are really important for reading. So if you look at the person on the right, those are showing what their eye movements are doing. And it looks like they have pretty good eye movements. They're moving across the page fluently and moving to the next line easily. Whereas the person on the left is having more trouble. Their eyes are bouncing around and they're having to go back. This can lead to obviously losing your place when you're reading, but also leads to slower reading and poor comprehension. And all that increased effort from having difficulty with the teaming, tracking, and focusing often leads to fatigue, avoidance, or just inattention. And then also with that can come frustration and other behavior problems. Visual skill number 4 is really a set of visual skills, but here we're talking about visual processing. So that's how you interpret what you see, also known as visual perception. So here are a few visual processing skills that are important for attention and reading. So visual discrimination is being able to notice the details. Visualization is being able to picture things in your head. Visual memory is remembering what you see. Visual figure ground is finding things in a crowded background. Visual directional skills, such as understanding concepts of right, left, up, down, are important to know which way the letters go so you don't reverse them. Visual integration skills um, is more about how you put everything together. So how your vision interacts with how you hear or your inner ear that gives you a sense of balance and your motor system. So vision related symptoms of the hyperactive impulsive ADHD can also include fidgeting, squirming, routinely getting up while seated, running or climbing at inappropriate times, having trouble playing quietly, or always being on the move as if propelled by motor. So vision can relate to these also. Dr. John Struff said, when vision leads, it guides. When it doesn't, it interferes. So children with the hyperactive impulsive type of ADHD may be having trouble using their visual systems to guide their action systems or motor systems. They may use other senses to help fill in for the visual deficit, such as using touch versus just looking with the eyes, and maybe having trouble filtering information. Much of our vision is actually dedicated to understanding where we are in our visual space. Now, there's other systems that also help us understand where we are in our visual space. So, vision is a big one, but also vestibular, which is your inner ear for balance, auditory, which is your hearing, tactile, which is your sense of touch, and proprioceptive, which is the information you get from your joints. Vision, vestibular, and proprioceptive work to direct and coordinate the motor system. So it's important to understand that ADHD is often more complex, in which the vision is just a piece of the puzzle. So ADHD can often cause deficits in other areas, such as spatial and body awareness and sensory integration. Other considerations that can influence ADHD include diet, sleep, too much screen time, or even screen addiction, allergies and food sensitivities, and other medical problems. But for the vision problems, optometric vision therapy is a good solution. What is it? It's a progressive program that's designed to remediate and enhance visual skills and visual information processing. We use a lot of lenses in vision therapy, and we use a lot of pictures that use 3D to specifically work on eye teaming, and special prisms to also work on eye teaming. It's a specialty of optometry, not ophthalmology, as ophthalmologists are typically eye surgeons. Thank you for watching this video. You can reach us at newhorizonsvisiontherapy.com, Facebook, or Instagram. You can email us. We have locations in both the Madison area and the Waukesha area. Our phone number is 608-849-4040. You may also want to check out cod.org or oepf.org for more information about vision therapy.